Well, so let's get to it. So the first question is, how common are mental health issues in youth?
So you probably know this as well as I do, that they are so common. And lately they've felt even more common. So we know that of all of our mental health issues, 50% of them will be diagnosed before age 14. So we know that this is a childhood, a very prevalent childhood condition. And we know that there are some mental health issues that are just the most common in kids. So we know that anxiety, behavioral concerns, ADHD, and depression are kind of the four big ones that we see in the children. There are others, of course, but those are the ones that are most prevalent. And I know that you're an expert in ADHD diagnosis and management, so you probably see a lot. So you probably think it's really, really prevalent. But I've seen statistics anywhere between 9 to 15% of children can be diagnosed with ADHD, so it's pretty common. And then somewhere around 7% of children have anxiety or behavioral issues. And depression, of course, it depends on how old you are as a child. They're the very young children, and then it gets more common as you enter your teenage years. So these are the ones that I'm always kind of keeping an eye out for, or the ones that I hear most commonly in my clinic. And I'd be interested about, what about you? Do you see these as your most common?
For sure, for sure. I mean, with ADHD, as you know, it's the most common neurobehavioral issue that we see in pediatrics, and it's just becoming much more complex too. I think we're seeing a lot more younger children, and I get a lot of those patients, the 3 to 6 year olds that general pediatricians don't have a lot of time, to see and really dig into that and really understand, is it just early brain development, normal behavior, or is it something else? And so I'm seeing a lot of those. And then, obviously, none of these exist in a vacuum, right? So the fact that you have one of these raises the likelihood that there's other things going on too. So we always have to be on the lookout for other conditions masquerading and or coexisting.
That is so true. If you have one of these concerns, then the likelihood you have two or even three is definitely there. So I feel the same that you do about these early childhood presentations of behavioral issues or neurodevelopmental issues. It is hard for general pediatricians to really dig into that. Some of our tools don't really work as well in our primary care setting for the younger crowd, right? So we do rely on some of our specialists to dig in and kind of help us to determine, what exactly is going on with this child and how can we best support them. And then, of course, for the younger crowd, therapies are really important. But as we'll get into a little bit more, access to those therapies can be just incredibly difficult for families to find and for pediatricians to refer. So we do rely a lot on our specialists to guide us and help us figure out if we're doing the right thing with diagnosis, and then if we are able to access some of the mental health care that these children really need.